New at 6, 13 News Now looks at the toll of mental health emergencies on police officers in Hampton Roads.
New reporting by Alex Littlehales found which cities are seeing a fall or in some cases a rise in policing mental health.
This facility will not end mental illness in the world, but it will help local residents in moments of urgent need.
Where many people see an empty shell of a building on Marcelo Road, Hampton city leadership instead see a fix to a growing dilemma. More than a dozen beds are soon to be built in the B.J. Roberts Behavioral Health Center,
Hampton Police and Fire,
to house patients suffering through a mental health crisis on the peninsula. In addition, that Hampton Police Division Chief James Weidman believes can't come soon enough.
Although we give it our best effort, there's always going to be a gap in the ability to provide the services that they truly are in need of, because we're not mental health professionals.
All right, we'll get an officer out that way, okay?
In calls for crisis,
911, what's your emergency?
where someone may be a risk to themselves or others, police officers often bear the burden of that first emergency response and have to place patients under what's known as an emergency custody order. After 8 hours, that emergency custody order may become what's known as a temporary detention order if that patient still needs help. And according to Virginia law known as the bed of last resort, a state psychiatric hospital has to accept a patient under a TDO if no other kind of psychiatric bed can be found, no matter how far away that bed may be. And in Virginia, most state psychiatric hospitals are operating at or near full capacity, meaning officers sometimes have to travel hours away from the cities they serve to drop off those patients.
For us, the numbers have been rapidly increasing year to year. Sometimes it can take as long as 72 hours for us to find placement somewhere in the state. And so we average at one point 700 hours a month where officers are with someone in mental health crisis.
Chief Weidman opened up about how an increasing number of mental health emergency responses in his city is increasingly pulling his officers off the streets.
2022 for ECO and TDOs hours, 6,743. For 223 was 8,077. The law just mandates that it's a law enforcement officer, thereby with limited resources, it minimizes our options.
13 News now obtained the number of emergency custody orders across the 7 cities over the last 2 years. Hampton is one of 2 police agencies in Hampton Roads that experienced a rise in ECOs. The city saw an increase by almost 200 patient cases between 2022 and 2023. Newport News Police saw an increase by 71 cases. The cities of Suffolk, Norfolk, Chesapeake, and Virginia Beach saw drops, but Virginia Beach Chief Paul Nigate weighed in on why there is more behind those numbers.
ECOs and those temporary detainment orders only account for about 2% of our total calls that we get from 911 and the community, but they tie up our officers and account for 10% of our dedicated time.
Which is why projects like the B.J. Roberts Center are seen as much needed relief for the region's police officers.
Although we do law enforcement extremely well, we're not experts in mental health.
In Hampton, Alex Littlehales for 13 News Now.
Portsmouth is the one police department that could not provide this data without manually going through court records.